Hi, it's Dr. John Zielonka. If you've been a patient or client of mine over the past 30 years, you know there is no one more dedicated to your health than we are. If I dare say so, as the founder of National Health Day in Canada, there really is no one more passionate and really dedicated to the health of not only my patients and clients, but also to our team here at the center and the community as a whole. We've had more questions on the coronavirus in the past couple of weeks than we've had on pretty much any health topic in the longest time. That is quite understandable given the situation what's going on right now. I wanted to reach out to you and give you some reassurance and a calm, rational approach that all of us can take. First and foremost, COVID-19 comes from the family of coronaviruses, and coronaviruses have actually been with us first discovered in the mid-1960s. So you've been exposed to coronaviruses in the past. They caused the common cold. SARS was also a coronavirus. Now, this is something we need to take seriously. Obviously, we need to stop the spread, and there are other steps that we need to take. So I'd like to go over with you the top 3 things that we're doing in our health center right now, the top 3 things that you should be doing for yourself, and then also 3 things that we need to learn from what's going on right now if we're to improve for things in the future. Here are the top 3 things that we're doing. Number 1, when you first come to our center, you will see this sign on our front door provided by the Ontario Ministry of Health. If you have any of these symptoms, if you feel that you're sick or believe you may be getting sick, if you've traveled outside the country, or if you've been in close contact with anyone who has COVID-19, please inform us before you walk in our door. Number 2, we're obviously taking all the necessary steps to sanitize absolutely everything that you may come in contact with. But here's the thing, this is nothing new for us. We've been doing this for the past 30 years. We meet and exceed all the requirements posted by the Ontario Ministry of Health. I wash my hands more on a daily basis than most people do in a month. We do all of this to help stop the spread of viruses such as these. Number 3, yes, we are staying open. Chiropractic care is an essential health service. This is not the time to stop providing a necessary health service, especially at a time in need. At any given point in our practice, we have people who are in acute pain, we have people who are in chronic pain, we have people who we are keeping off opioids and helping prevent that crisis as well, especially those who are more at risk. We are not going to abandon seniors, the elderly, children at this point in time. Now, obviously, we're monitoring the situation very carefully, and if there's a need to change that, but at this point in time, we're going to provide health care so that people can actually optimize their health, optimize their immune system. Here are the top 3 things that you should be doing. Number 1, it's important to stop the spread of this virus. So obviously, I don't believe you really need me to tell you should be washing your hands on a regular basis. We should be doing this all the time. And yes, good old soap and water is better than any hand sanitizer out there. If there was only one thing I could do to help the world get healthier, surprisingly, it wouldn't be a chiropractic adjustment. There's certainly no drug or vaccine. It's certainly not the best vitamin pill or new exercise program. The best thing in the world we could do to improve the health of the world is proper hygiene, clean water, and sanitation. So please, let's continue to do that. You're washing your hands not just for yourself, but you're washing your hands for others as well. Also, in the same vein, please stop touching your face so much. It is estimated that the average person touches their face 2,000 times a day. Understand viruses need to get inside your body. If you'd stop touching your face, you would obviously help prevent that. If you find the need to do so, wash your hands first or use the inside of your shirt. Number 2, it's time that we focus on health. So here's the interesting thing. Yes, the Ministry of Health has to focus on stopping the spread of this disease. Medical doctors are very good at dealing with sickness and disease and so forth, but we also need to focus on actual health. While there's no one miracle cure for COVID-19 or for any virus for that fact, obviously there are a number of things you can do to optimize your health. That anything from obviously the chiropractic care we provide in here will help optimize health. You know that I'm the only doctor in the city that holds a fellowship in vitamin supplementation. There are a number of vitamins that will help optimize the immune system. If you want more information on that, speak to me when you're in our center. Vitamins are not a replacement for good nutrition, so that's why it's called vitamin supplementation. That's in addition to good nutrition. Make sure you're eating well. If you are stocking up on dry pasta and canned foods, understand they may not be the best and healthiest foods in the world. Make sure you're getting adequate sleep. Make sure that you're trying to stay positive throughout all of this. Keep up your exercise program and spend time with your family. Number 3, let's get our information from credible sources. As I said, we get a lot of our information from the Ministry of Health. That's where you should be looking in terms of preventing sickness and disease. If you're interested in ways to optimize your health, then please ask us. Stop using social media. Facebook Jane or Dr. Google Bob are not your best sources, nor have they ever been, for optimizing health. And in this case, it's not just social media. Mainstream media could have done a much better job with all of this as well. Make sure you're getting reliable health information from the experts, not the fear-mongering and not the panic, but take the appropriate steps. Last but not least, what are the top 3 things that we can learn from this? Because the truth is, we need to take this as an opportunity to learn. Number 1, it was very clear that there were many governments and news outlets that could have handled this much differently. That's important because as much as I'm an optimistic realist and urging that people stay calm and not panic, this is going to happen again. Viruses are not going away anywhere. They've been around forever. We need to know how to deal with these in a better manner. That brings us to number 2. The focus has to start to move towards health. Was stopping the spread of the disease important? Of course it was, and that's exactly what medicine and health departments excel at and so forth. But the truth of the matter is, at any given point in time, we are exposed to viruses all the time. If exposure were the single biggest factor, then every doctor, every nurse, every hospital worker would be sick all the time because they're always exposed to viruses and germs. So it's not the exposure that is the biggest factor. Of course we need to contain that, but the biggest factor is how well is your body capable of resisting that. And that's where focusing on health, optimizing your immune system and so forth, doing all of the things, there is no one magic bullet, doing all of the things that will optimize health so that we can withstand these in the future. Number 3, hopefully what we've learned is simply be kind to one another. This was not a time to fight over toilet paper or to charge $100 for a hand sanitizer. This was a time that you should be calling your elderly senior neighbors and volunteering to pick something up for them or checking in on them and seeing they're okay. These are the times that should bring out the best in our community. Thanks very much for listening. Please feel free to share if you like. If there's anything we can do to help, then please let us know.